This is an important lecture because this is a new technology that's just come to the forefront in medicine. It's been researched for many years, and some parts of this actually stemmed from some studies that were done and are utilized in medicine today. Specifically, you may have heard of things like bone marrow transplants in kids who have leukemias, skin cell derivation to be used in patients with burns, and also for corneal transplants and repair. Essentially, we all carry stem cells in our body, even in our adulthood. They reside in different parts of our body, such as our bone marrow and our fat cells. We have to be able to maintain our cellular function. We have cells that have different functions, and those cells are turned over on a regular basis. For example, red blood cells, they get turned over about every 120 days. The cells inside of our stomach or in our gut turns over about every 4 days. Hair cells turn over about once every 4 years. So each cell that gets turned over is derived from these stem cells, or these basic cells that really just sort of sit there until they're turned on to create more cells. When we damage cells or we have a disease state, those damaged cells need to be repaired, whether we cut our skin, whether we break our bone, or whether we have some type of internal disease that requires some type of healing. A classic example would be, if you injure your knee, your anterior cruciate ligament or your ACL gets torn, that has to be repaired, and hopefully it can heal itself with time. Okay, so what happens as we age with our what are called mesenchymal stem cells? Those cells start to decline, and they decline fairly rapidly. You can see in a newborn, 1 of every 10,000 cells in the bone marrow are stem cells. When we become a teenager, that drastically reduces to 1 in 100,000. And as we get older, you can see there's very few stem cells available to be called upon to repair tissue and to maintain that cellular activity. This is a slide showing doubling times for stem cells. In other words, how long does it take for these cells to divide, and then how is that timed? If you look in fetal tissue, you can see doubling time in hours is very, very quickly in fetal tissue, but as we get older, that drastically reduces as well. There's been studies that have taken bone marrow aspirate, and normally in someone who's had, remember I mentioned an ACL tear, so let's say I had an ACL tear, I get surgery to repair that tissue, it's going to take me 360 days for that ACL to heal, okay? If I use PRP, if I mix them, and I'll discuss that, as many of you probably heard about that, that's where we spin down blood, platelet-rich plasma, and we inject that. That can cut that time down in half. Well, BMAC, or bone marrow aspirate concentration, makes it 7 times faster to heal than normal healing. So where do we get bone marrow? Typically, when we extract bone marrow for our use in our clinic, we will get it from either the pelvis or from the leg bone. And then we can transplant it into diseased tissue to help augment repair of that tissue, whether it's an arthritic knee or hip or in the shoulder. We're starting to use it now in the spine and the discs, as well as the facet joints, to help repair those damaged discs as well as those damaged facets. Now that you know a little bit about BMAC, what about amniotic tissue? Amnion was kind of a target of a lot of scrutiny 15 years ago, or stem cells in general. Remember back when they started talking about stem cells, and it was going to take aborted fetuses and utilize these cells to do science research? Well, amniotic tissue is where we derive a certain type of tissue. I'm going to describe in a minute, but it has nothing to do with the embryo. What we did find was that amnion, which is derived from the placenta of healthy mothers after the baby's born, we can take some of that tissue from the amnion as well as some of the fluid, and we can purify that, extract it, store it in a specific way, and utilize it to help augment the effect of our own cellular activity. In this case, amniotic tissue, what's being used is 2 different types. There's amnion membrane and amniotic fluid, both of which contain a very rich source of cytokines, proteins, hormones, and other types of tissue that helps to enhance healing. The other effects of amnion is that in addition to enhancing the repair of diseased tissue, it also prevents infection. It has an anti-inflammatory component, and it has an anti-infective component, and it also reduces pain. One thing that I highlighted here, it tracks the body's mesenchymal stem cells to the application site. So if I inject amnion into the knee, it sends that signal to your body saying, hey, we need you to deposit some of these stem cells here to separate or to divide and start reproducing and start healing this tissue in this joint. So what happens next is, what if we were to mix those two or bring them or inject them into the same area? So now we have BMEC, which we know is your own stem cells. We're putting that into the body, and then we're injecting amnion, which we know helps to recruit and turn on those cells to start acting more vigorously. What conditions can we utilize this type of technology in? Well, bone fractures or degenerative disease in the joints, which we mentioned, people who have ongoing arthritis in the knee, or they have a hip arthritis, and they're contemplating maybe getting hip or knee replacement surgery, but they're not ready to take that step yet. Also in disc regeneration, tendon and ligament tears, and loss of cartilage.